Hello, All-Star listeners, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, please let us know.
Wow, that flowed so nicely.
Thanks. I've been really trying to memorize it. So we need to mention a couple of things. One, that our second episode of the Vet Clinic has been posted and is out. And people seem to need some humor in their lives. So it's gotten some good responses.
And it was a time to create it. It was funny. We had to do many takes, and we were
I don't even know how many
takes.
takes. How many takes? 11, 20?
Oh, I don't even know. After a while, we're like, okay, just use it.
Yeah. You know. And then after watching the video, I was like, why did we clean up the poop every time? We should have just left it on the floor
because you didn't see the squirt.
Exactly. I was like, that was the most work of the entire thing was the cleanup.
We went through a lot of chocolate
and paper towels. Yes,
because it wasn't a small amount. It was
a good squirt.
Yeah.
It was a good squirt because we put water into the Hershey's syrup. We're telling everyone our secrets into the syrup bottle, and so
it smelled sweet in the lobby. We had to clean that up.
It was not good.
It was
not good.
But good end result.
But it was good.
Yeah,
end result.
but it's good.
Everyone had fun doing it, which is one of the goals, and it was fun to watch. So,
to be continued. We shall
hope
see.
everyone had a good New Year.
Yeah.
Holidays are over.
That's right.
Bring on 2023, baby.
Next year, on to the next
See
year.
you 2022.
That's right. It went by fast.
Oh, way too fast.
Just wait till you get older. It goes by even faster. The blink of an eye. Yes.
Time's a flying when you're having fun.
That's right.
Whatever. Okay. So we received a very heartwarming message from one of our listeners who submitted a question that we answered for the podcast. Get the tissues ready. This is a good one. Hi, All-Star. I submitted a question for the Veterinary Roundtable podcast a few months ago about seizures in cats, and your vets advised that it's definitely not normal and to seek out what could be causing it. I brought my cat to a different vet who shared my concerns and ordered a blood test. His T4, which is the thyroid hormone, was way above the normal range, so they began treatment for hyperthyroidism. I'm happy to say that ever since he started the meds, he hasn't had a single seizure. Thank you so much for your advice. It assured me that I was right to be worried and encouraged me to fight for him. He's doing so much better now. He's no longer agitated and constantly hungry, and his weight and the quality of his coat have improved. I'm so glad that we figured out the problem and got him the help he needed. You saved his life. From Depressed Capricorn 69.
Way to go.
That was pretty cool. That's our first time come back around comment, I feel like, and to hear people listen, and
it can make a difference.
Yeah. It's pretty cool.
It's awesome.
Change one animal's lives.
One moment can change
one podcast at a time.
I know, exactly.
Yeah.
That's awesome.
So on today's episode, we have myself, co-host and associate veterinarian, Dr. Ashlyn Duckwall, administrative assistant, Sam Cercio, room assistant, head room assistant.
Hi, I'm Becca Miller.
Nicole Havens, and head veterinarian, Dr. Emily King. You pulled a fast one on us. Yeah. Wow.
Yeah. I'm just filling in. She's on vacay in Florida.
Oh, nice.
Yeah.
Oh, lucky duck.
Yeah. It must be nice.
Where at in Florida?
I don't know.
Oh, it doesn't matter.
It doesn't matter.
Anywhere but here.
Yeah,
exactly.
Yeah. Oh, that's nice. Good.
Yeah.
I'm glad she's enjoying it. Okay. How are you guys doing today?
I'm good. A little hungry. It's lunchtime, but
Yeah.
good.
Yeah.
Should have some bowl of candy for a sugar rush.
Ooh,
So sorry. I scarfed some pasta before I came in here. So
Well, I told Christy, I was like, I'm going to go heat up my lunch. And I was like, oh, wait, it's Tuesday. It's lunchtime.
Yeah.
I'm on the podcast. So I texted her and I was like, it'll be a little bit before I come back upstairs.
I'll be back at some point.
Everyone's always hungry on the podcast.
yep.
That's okay.
You
How are
can't
you,
avoid
Dr.
it.
King?
I'm great. I'm just living my best life.
Living the dream.
Yeah, absolutely. So,
Love it.
okay, icebreakers.
Well, oh yeah. Never mind. I jumped ahead. My bad. Continue. Ignore me.
What are you most excited for this year?
Everyone's really excited.
I don't care. I can go first.
You go first.
I'm excited because next month, for my birthday, I'm taking a week-long trip to visit my family in Texas.
Nice.
That'll be nice and warm still.
Hopefully.
Yeah.
I've never been to Texas.
I love it. This will be my 4th time to visit.
Nice.
It seems hot.
Yeah.
Summertime, definitely.
Yeah.
Hot and humid.
Yeah.
Yes.
I mean, it's a huge state. There's lots to do.
oh yeah, for
So-
sure, for sure. They're in the Dallas-Fort Worth area,
Nice.
so
Cool. That'll be fun.
I'm excited.
Safe travels.
Thank you. Thank you.
You're welcome. I'm excited to get this watermelon out of my belly. She's not even a watermelon yet. I still got a couple months, but
Yeah, you're
yeah.
close, but you're not.
Yeah.
But I'm
It's
sure it'll
when
go quick.
it's amazing. Like you hit 3rd trimester, you're like, oh, this is a lot harder.
yeah.
Yeah.
But-
Yep.
No, but we're excited for that, obviously.
Are you guys all ready? Do you?
We get carpet in the nursery on Thursday because it was real nasty. So we're getting fresh carpet and putting up the crib this weekend.
Very exciting.
So it is
That's
quite fun. Quite fun.
Very cool.
Yeah.
Nicole, what about you?
We might be getting engaged this year.
Ooh. Yeah.
Yeah.
It's
That's
nice
about
to
it.
have that
Yeah.
mic in there. It's exciting.
Sam,
Yeah.
you better be listening.
No, I don't want him to listen to my words.
Okay.
Yeah, true. From the heart. You want
Yeah.
him to want to do it.
Yeah.
Yeah.
Oh gosh, too funny. I'll text him then. Okay. I am looking forward to summer.
Yes.
Yeah.
Just like bring on the
It
warm
hasn't
weather
even been
again.
that cold yet.
I
know.
know. I'm just ready for like April, and then I make April like be the start of summer.
Yeah.
It's not, but I make it.
It's close enough.
Founding
I
it
don't
to be.
know. I
Yeah.
remember there were some Aprils when we were kids. We had the slip and slide out because it was hot enough to
Yep.
get the slip and slide out.
Yeah.
But then it'll snow. So,
right,
True.
3 days
Who's
later.
to say?
I feel like you start to see a little fresh green grass though, and that does
Yeah.
change a lot.
Yeah, makes
Just that
all
little
the
hint
difference.
of green.
Mhm. That's true.
You should get one of those sun lamps. So if you
I
have
can
like
just
yeah.
pretend year round. That
Yeah.
it's-
Yeah.
yeah.
It does say
And then as soon as I
it
come
makes
out
a
of my
difference.
office, then it's like dreary
Yeah.
and dark.
We knock on your door and you're just like camping out in a lounge
Also,
chair.
I heard that we are not going back to. We're not changing time zones anymore.
Yes.
Wait, really?
Well, yeah, once we spring forward, that's it.
Yeah.
We're done.
Yeah.
Game over.
I did
Oh,
hear
wow.
that too.
There is no more falling backwards.
Well,
Yeah.
Why couldn't they
well,
just leave it on the falling backwards?
Falling
part?
backwards is the best part.
I mean, and then
right.
just
I
like
don't
call it a
want to-
day.
Yeah.
I thought
Why are
it
we
was
gonna
for
spring
kids
forward?
waiting for bus and stuff. Isn't
Oh,
that
they
why
had a
we
whole bunch
it?
of reasons why they were doing
Oh.
it, but I think that it was
Wilson will appreciate that.
yeah.
He bugs me at. He normally eats at 5, so when you fall back, he's bugging you at 4:00 for dinner. It's like, bro,
Yeah.
it's 4. It's 4.
Yeah, it really throws off the dogs.
Yep. There's no more time zone for us.
Yeah.
Huh.
That's how it was when I was growing up.
Well, isn't like Arizona or something already not doing that? There was like one
Yeah.
state that was doing
There's
it.
some places that don't do
Yeah.
the daylight save. I don't know who
Oh,
though.
interesting.
Yeah.
Yeah.
We are now going to be another
It's
one.
gonna be one of those
Going
things we're
back.
gonna tell our kids and be like, "Remember when we had
Oh,
daylight
yeah.
Back in my
savings?"
day.
That's right.
Okay, number 2. What movie and/or TV show do you think everyone should watch? Oh, The Office.
I know.
I like
right?
thought that. I was like 100%. I still watch it every night on the couch.
Yep.
Just
It's a good
on
one.
repeat.
Mine
Yep.
was SpongeBob.
Oh.
Mm.
Do you know how many friends
Classic.
I've made with strangers simply
Just
because of a SpongeBob quote?
Yeah.
It's funny.
Oh,
It's
yeah,
a good.
for sure.
And I never
Subtle humor.
realized how like many adult things were in there until
Mhm.
like watching
it
back. Yeah, I'm
Yeah.
like, oh,
Yeah, they
Interesting.
slide those in.
Yeah.
I'd say Seinfeld.
Oh, yeah.
Seinfeld's good. Have you watched Curb Your Enthusiasm?
No.
It's good. It's from the owner, the writer.
Oh,
Anyone else?
Seinfeld.
Uh-uh.
Yeah,
Okay, I'll have to watch
Larry
that.
David. It's pretty funny. It's kind of like Seinfeld, but
Okay.
like different.
Nice.
The same, but different.
The same but
Yeah.
different.
But like, not as like, it's not like dirty, but it's not like clean.
It's murky.
It's murky.
Great description.
A slight dusting.
Yeah, exactly.
That's how I feel about New Girl. I also love New Girl.
Oh,
It's like
Oh,
the
New
same
Girl's good.
but different humor
Yeah.
as
Yeah,
The
I kinda
Office.
like that.
Yeah.
Yeah.
Good stuff. Okay.
Good stuff.
Yeah.
Okay.
Anyway,
So,
nice
we-
segue.
yeah, nice segue into the Veterinary Roundtable has an
I'm-
exciting
I'm
offer.
first.
Oh, you're first.
I'm sorry.
Oh.
I messed it
Messed
up.
up the first
Embarrassing.
time.
Okay, go for it.
Okay, the Veterinary Roundtable has an exciting offer for our listeners. Use the link www.audibletrial.com/vet Oh, she made a face like I said it wrong.
No. I'm just like, wow.
Vet
we're never gonna memorize
Roundtable
that.
to try Audible Plus Premium for a 30-day free trial. By using our link, you'll also receive 1 credit or 2 credits if you're an Amazon Prime member and access to the thousands of titles through the Audible Plus catalog. What else does Audible offer, Dr. King?
Podcasts, guided wellness programs, theatrical performances, comedies, originals, and more. Plus, one of my favorite books, which is Crucial Conversations,
Oh, classic.
classic for everyone here at the clinic, is available on Audible and is fantastic in helping individuals navigate tough conversations in the right way. That is www.audibletrial.com/vet roundtable for a 30-day trial to Audible Plus Premium and more.
Yay.
And if you have not read Crucial Conversations, read it.
Life-changing.
Life-changing. It could be, you should do it this year. It should be like a 2023.
Yeah.
If you're like one of those people that's doing like doing a book a month,
Yeah.
make it one of your books.
Yep.
Yeah,
You
'cause
won't
it's
regret
not
it.
a hard read either.
No, it's pretty easy.
But then you might because you'll have to have conversations. But you still like it. So
but
do
you'll
it.
be more comfortable.
But you'll be more
Yes.
comfortable.
Yeah.
Yeah.
That's right.
Segue.
Yep.
Segues all around.
Okay, so real quick before we jump into our cases, an update on Dr. McDivitt's toe cancer case that she shared last time. To recap, there was just a gnarly mass on this dog's paw, on its toe, really bad place to remove it because we knew it was a bad mass, a mast cell tumor. So she did the injectable treatment. What's it called again?
Stelfonta.
Stelfonta. And so we were just kind of updating to see where we're at because when you give that, the tumor is supposed to necrose, die off, sludge off, all that. That happened. She has many pictures if interested. It got real swollen, real dark and nasty. It was like the plague on the toe. It was very bad. But then now the light has shown and the toe is healing very, very nicely. It's a very small, healthy wound.
Granulation bed?
Yep. Granulation bed.
So the owner's very happy.
And she was great. The owner was great, like sending 2 pictures a week and like marking them day X and day Y, whatever. So
That's awesome.
yeah, it did what it was supposed to.
And if you already discussed this, what's the benefit of doing that? Is it just you can remove ones that are harder to remove?
Well,
Or
part
is
of
there
it
a
was
benefit?
like
Remission,
the
right?
location margins. Yeah. Cause
Yeah.
I mean, it looked like, I think you couldn't
She
just
would've
take
had to
one toe.
take
You
a
had
toe.
to take 2 toes.
Okay.
And
But
I think it was the weight bearing toes.
Weight-bearing
Which is
toe,
not
yeah.
going to work. So
Is there any benefit in terms of like if it was just like on a shoulder or anything like that? Or
yeah, it's something that you can definitely consider for mast cells is one of the main tumor types,
Yeah.
but there's very strict criteria. So location, size, things like that. So I haven't had a case to try. I tried one time on a back thigh, but it was too big and the location was
Yeah, it
not
needs to be
great.
extremities,
Mhm.
like lower extremities, right?
Yeah.
So, and then the size of the tumor has to be less than, I can't
I
remember,
don't remember
2
either. but-
centimeters. It's small.
Okay.
So,
Yeah.
but it's great because when you're talking about digits, you really have no options because you have no soft tissue
Yeah.
around the digits.
That'd be
So
really cool.
it keeps you, it's
From saving
limb
those.
sparing. I mean,
Yeah.
digit sparing, you know? So it's a neat, innovative treatment.
Yeah.
It's
a great
really,
option.
Yeah. So, I mean, it's an expensive injection, but it's less than surgically
Removing it.
intervening.
Right.
Well, and it's just the aftercare. Like
Yeah.
owners have to be prepared for
All of
what's
that.
about to happen.
Yeah.
But
Yeah.
I mean, I think it's like 2 weeks out and it's already
Oh,
almost
wow.
done.
That's
so.
pretty quick.
Yeah, because I think by day 30,
Yeah.
right, it's supposed to be like
Fully
Done.
healed.
Back to normal.
Yeah.
Wow.
Huh. That's pretty quick.
neat drug.
It's always something to consider.
If you haven't heard about it, Stelfonta.
yeah.
Check it out if you're a veterinarian dealing with
Commercial.
hassle.
Yeah.
That's right.
Okay, King, you go first. What's your case?
Okay, so case collections. What did I say I was going to? Oh, so I was going to just briefly talk about one of our veterinarians here has a case that is an older dog with masses on the dog's rear end or on its anus, and they're small, but yet they've been showing up frequently. And Dr. Pulse has already removed them once, so we know what they are. But they commonly will show up around the perianal adenomas, or the tumor type that this dog has. They will commonly show up around the anus, and they can reoccur. Or you just get new ones. Dogs that get them like to get them, but it can be really problematic because you don't have a lot of extra soft tissue that you can remove in that area. And so this particular dog came in again on Monday because the perianal adenomas had gotten very inflamed. And I mean, it was basically the entire circumference
Oh, wow.
of the perianal area. So she basically did like almost like vulvoplasty.
Wow.
That's crazy.
Probably difficult to defecate. And
Yeah,
was he
and I think,
uncomfortable?
well,
or?
no, the dog actually seems very comfortable, but he's bleeding from the from rubbing his tush on the ground.
Yeah.
So then the perianal
That's so-
adenomas are bleeding, which is so that's why they're surgically intervening.
Right.
Yeah.
Yeah.
So
Wow.
Ouch.
yeah,
Ow.
they're very annoying. I mean, it seems like you can, and I guess my point in bringing it up is that if you have a geriatric pet that has a mass on the rear end, just get it removed. It's so much easier when they're small than when you get into these large perianal masses. Sometimes they're non-resectable. Sometimes you can't even do surgery on them. Some of them are benign. Some of them are malignant. Just go get it checked out.
Yeah. Yeah.
So there's a
tough
reason
surgery.
to check your dog's butt.
Yep.
There you go.
Not just the poop.
Not just the poop.
Where
Check
does the
dog's
poop
butt.
come from?
That's right. Exactly.
Nice. Okay. Well, wish well on their recovery.
Yep.
Yeah.
I'm excited to see how it does post-operatively.
Yeah.
Nice.
Well, I guess I can talk also about my butt case.
Okay.
A nice segue. So we saw a case. I don't know. We've been seeing the dog for a little bit. Dr. Duckwall saw it once too. And I think it was back in like November or something. It had been rubbing its butt on the ground. I don't know if that would it be correlated to that at that point?
No, because at the time when both McDivitt and I saw the dog, it was skin issues.
Yeah.
But every time the owners would mention the dog like howls or cries and whines when he's defecating.
Yeah.
And that the the balls are like really small and stuff.
Yeah.
So yeah.
Yeah, but virtually, it had come I think a couple weeks ago for not defecating in like 2 weeks. And virtually we did an x-ray and it was like a big ball, whether it be a mass or fecal matter. And then the Dr. McDivitt went rectally, virtually had a pocket right inside where the fecal matter had basically created an obstruction. So she was like scooping it out, which just opened the floodgates, unfortunately. But I think he needs surgery for it, but I don't know if they've gone yet. So
It's a really difficult surgery
I
yeah,
was gonna say,
Yeah, it's
that's
not-
like a
yeah.
specialty thing.
because
Yeah.
the wall,
Yeah.
the muscle wall basically has been broken
Virtually,
down.
Yeah,
And so then it pooches through the muscle wall that's holding the
Yeah.
colon and the rectum. Yeah.
yeah,
So it's really hard.
And it was interesting because when we were treating he had terrible like skin inflammation back there. So when doing the rectal, he was uncomfortable, of course,
Yeah.
but you can feel like almost a ramp going down. But it was interesting because we were like, all right, let's focus on the skin right now. We got him on prednisone. And he actually did really well defecating on that prednisone too. And then talked about x-rays and stuff like that. And so it was kind of one of those things where something's going on, but you're like,
But-
okay, let's focus on each problem separately.
one
and
step at a time.
yeah, it was interesting.
It was crazy.
Yeah.
Yeah, the x-rays were really cool to look at. But
Hopefully they get the surgery.
yeah,
It's got to be painful.
I couldn't imagine.
No.
Yeah. Ugh.
Okay. To be
Like it.
determined or continued? Not
Yeah.
determined. We know what it is.
So mine always end up being my own pets or my relatives' pets here recently. But I was going to talk about kind of our rabbit hole of investigating how we found out that Jax has Cushing's. So I think he came in for a dental and a mass removal last summer, and we did in-house labs. And when they came back, Joan said there was a value that was like super high. She was like, if that's really the case, like I don't want to put him under anesthesia. So are you okay if we run it again? I was like, yeah, absolutely. Because if there's something wrong, I want to do something about it. So we ran it again. That was fine. But she was like, that's still kind of weird to me. Are you okay sending out a wellness panel? I was like, yeah, sure. He was almost 8. So I was like, oh, let's just do a senior panel. That's fine. And his triglycerides were really high. So then she wanted to look into that. And of course, we've been doing junior wellnesses, so we didn't have anything to compare it to, unfortunately, for the triglycerides. So then we did, which is it, a low dose Dex. and some add-on blood work, and he came back with Cushing's. But we wouldn't have found that if we didn't do pre-surgical blood work. And if we didn't even have that weird value, she wouldn't have even wanted to do the senior wellness panel to also find the high triglycerides. So then I talked to Jones and Dr. Pulse about meds, because if I didn't have to start Veterol, that would be swell, because it's not cheap. So I talked to her about supplements versus Veterol. So I found an adrenal support powder that I do twice a day, and we rechecked his blood work 6 weeks after I started it, and she said he was almost back to normal just with the supplement versus starting the Veterol. So he comes in March for his annual, so we'll just redo his senior blood panel and see where his triglycerides are at too, because I switched him to a low-fat food on top of that too. So, and that was a struggle to do that. So, yeah.
Nice.
And he's how old?
He just turned 8 in November. But there were no clinical signs. It was all blood work that we figured it out. Like, I hadn't noticed. My mom works from home, and I said, have you noticed any increased thirst, any increased urination? Like, he's weird about eating, but there hasn't been, like, his appetite hasn't changed at all. So, I brushed him really well, and I texted Lauren Winston because Bo has Cushing's, and I was like, is hair thinning a sign of Cushing's? But this was after the diagnosis that I even realized that he had some hair loss, and it's not significant, but I can just tell a little, and it's really on his hips that I can tell the difference. But yeah, so if he wouldn't have come in to have his dental and done the pre-surgical blood work, I probably still wouldn't even know that he has it.
I would say that's the majority too of how people find Cushing's. I mean, I'd say them are symptoms.
Yeah.
Yeah, because Cushing's is the weird disease where you may not ever have signs and you're just waiting, or there's signs, but they're not that bad.
Right.
So they just think it's their normal behavior.
Yeah. And it's nice because you don't have to treat it right away. So
so that's why I wanted to do the supplement route. I mean, the supplement's not cheap. It's like $70, but versus doing all the trials with the Veterol to find out what his right dose is. Yeah. Because that's another thing, is that technically, like, based on his weight, he could be doing a 60 milligram tablet, but he might do really well with a 5 milligram tablet. But we don't know until we do all that and then check blood work and stuff like that. So I was like, well, I'll start the supplement route. If nothing is changing or it's getting worse, then obviously I'll switch to the Veterol. But he does really well on the supplement. So
nice. Love it. Good boy. So my case is new patient, new client. Just saw them last week, 12-year-old white boxer. And he presented for interest in removing a mass. But the mass was a very large, I don't even know what fruit it would be. It was a large...
Grapefruit, maybe.
Grapefruit, that's a good one. Yeah. Grapefruit mass on the scrotum. And at first, I'll be honest, I thought that the testicles were involved in that mass, but after palpation and looking at it, the mass actually was weighing down the scrotum like to his ankles, and then the testicles were up further in the scrotal sac, like closer to the body. Yeah. And so, unfortunately, it did not look like a nice mass, which those never are usually. So owner was great, went forward with removal of it. So we essentially did a neuter plus what's called a scrotal ablation. So you just remove the entire sac and the mass, and submitted the mass and the testicles to the lab, and it did just come back as what we call low-grade mast cell tumor, which, to be honest, was like a really good scenario because surgical excision is, I don't want to say curative because mast cells can go other places, but in a low grade, you're in good shape. It was interesting. The testicles came back with having small cancerous masses as well. Now, interstitial cell tumors. So very small, and typically those don't cause a huge issue in dogs if he were to have those still, but removal, castration is the treatment of choice and curative. So we fixed him.
2 for 1.
Yeah, exactly.
2 for 1.
2 for 1.
And we took off an eyelid mass at the same time, but that was just bothersome. Right. And for a white boxer, which usually come with bad genes, he honestly, blood work is great, and everything else on his physical exam looks really good. So
It's awesome.
He's got to be so much more comfortable.
Oh, right.
yeah.
Sure.
I
He
couldn't
was
imagine.
weighing him down,
Yeah,
literally.
like, literally.
Yeah.
Carrying around bowling balls.
Yeah.
Yeah, it was not pretty.
No. He's recovering great so far. So
That's
Good.
awesome.
Nice.
good.
Good
Yeah.
deal.
Okay. On to listener questions.
All right, on to listener questions. Yep.
You go for it.
Okay. Do you have, so our question comes from Logan Elise 21.
Sure. Sounds great.
LOGANELIZ 21. Thank you for the question. Do you have any information on Addison's disease in dogs? I have a 9-month-old puppy who was diagnosed when she was 6 months old. I keep trying to learn. Great job continuing to learn.
Yes. It's quite the disease. Where do
call
we
it the
start?
Great imitator.
Yes.
Yeah.
That's what we were always taught to call it because it can mimic a lot of different diseases.
Yes.
And although she doesn't tell us what kind of dog she has, does anyone want to guess what she might have?
Poodle mix?
Probably. Exactly. That'd be my guess. And a young
Mhm.
dog, it would be a poodle.
Yep.
That'd be high on my
Females
list.
are more predisposed than males, unfortunately. I mean, that's pretty young.
Yeah.
Do you see a lot?
I would
6
be
months?
interested to see how they
Diagnose
diagnose
her.
so young. Yeah.
Yeah. They must have, I would assume, at that age gone through a lot of different things to get to
Yeah.
that point. But because it's a great imitator, that's what we do. We start with, you know, if she was just having, let's say, diarrhea, then you start with simple things like parasites or
Yeah.
just food intolerance, things like that. And then when they're not responding, you dig deeper. And the way that you test for Addison's is you look at the cortisol level in the body. So that's a blood test, which is nice and not too invasive, but that will then help you guide if you have to confirm it, essentially. So do you guys know what value you're looking the cortisol to be? Like if it's a certain number or less?
Oh, I did
The
I don't know if I ever knew.
magic number is 2.
2. I was going to guess 1.
Yeah.
It was somewhere around there.
If it's less than 2, then you're like, okay, you have to confirm it, essentially.
Because I knew it was hypo. I can't say.
Hypoadrenocorticism.
Yep.
Yeah.
And which is, interestingly enough, the opposite of Sam's dog that
Right.
we were just
Mhm.
earlier talking about. I think that there are the primary and secondary Addison's disease that we should mention as well.
Yeah.
So, you know, this dog, maybe they found it on pre-anesthetic labs
Yeah, that's
via
what I
a
was
low protein.
Thinking.
And then they went and said, okay, well, why does this dog have a low protein? And so then Addison's would have been on the list for a reason like why it had a low protein. Or maybe, you know, because typically the Addisonian dogs will have these waxing and waning illnesses. And then they'll a lot of times suffer from a stressful event that tips them over. And so then you'll see them go then into, you know, a true emergent situation. It's one of the diseases, well, primary Addison's is one of the true emergencies that we have. Like
Yeah.
if we do not fix them in, you know, 12 to 24 hours, they'll die.
Addisonian crisis.
Yep. Addisonian crisis.
Yeah.
Exactly.
Yep.
Their body gets really unhappy without steroids. Well,
Nice.
ours too.
Yeah.
But
Yeah. You need it
So,
to survive.
yeah.
Yeah.
So that adrenal gland, or our adrenal gland, makes 2 different types of steroids. So in the primary Addisonian, you're missing both. And
Yep.
then in the secondary Addisonian, you're only missing the glucocorticoids.
Right.
So
Which is when you don't see changes on blood work. So that's why, again, it's a kind of a complicated disease because let's say you're working up a case and you get blood work and it looks fine. Then you're like, well, you have to have that discussion of we can keep searching and look for this disease or we can try these other things first. And, you know, it's one of those unfortunate potential ticking time bombs. It's not always, but I feel most Addison's disease patients like become diagnosed in a crisis event
Yeah.
or a near crisis event. So
yeah, I think the primary ones are always typically in a crisis event. You know, we were always taught that if you have a pet that's been diagnosed with secondary Addison's disease, then the rule of thumb is typically they're going to convert to primary. But those patients are only treated with an oral steroid. So like
and it's mostly
prednisone.
GI signs you go
Yeah.
off of. So
Interesting.
And so you treat
Yeah.
those patients with that. And then you counsel the owners to know, hey, if you ever see your pet not behaving correctly or not, you know, now you're with those patients, we're also checking electrolytes on like an every 6 month, every 12-month basis. And so we're trying to catch them when they might be becoming a primary Addisonian. I've never been able to catch them like and be
That
like
quickly.
preemptively
Yeah.
been like, oh, hey,
Until
you
it's-
might be becoming a primary
We're
Addison
leaning
case.
this
Yeah.
way,
Yeah. You know, it's always they're
it's
in
too
front
far.
of you. Like
Mm-hmm.
the easy ones to diagnose are the ones that are look like doo-doo. Like,
Yeah.
Right.
like they just crashed, you know,
Yeah.
then it's like, that could be Addison's disease. It's the ones that have the waxing and waning illness that are like
Yeah.
the ones that I feel like are tricky.
Yeah, I agree.
When I was younger, I had a patient when we first opened the clinic that had a lameness. That's how it presented,
Wow.
was lameness.
That's interesting.
Yep.
Fascinating.
And so that was, you know,
Interesting.
you're chasing that instead of, you know, it's like, oh, and then you submit the lab work and it's like, oh, okay, wait. And then she goes into an Addisonian crisis
right.
and
You're
it's
like,
like,
oh,
okay,
there it
of
is.
course. There it is.
There it
Yep.
is.
Yeah.
And like once you get them started on treatment, like Addison's is treatable and
Yeah.
it is life-saving
Well
treatment.
managed.
Oh yeah, for sure.
But the tricky, like you still have to consider too, like stressful events. So we have one of my Addison patients, he comes in, one to get his primary shot treatment, which we can talk about, but also sometimes to get nails done, all that stuff. And so they have to preemptively increase that oral steroid he gets because in a stressful event, the
Yeah.
body's going to try to push out more steroids naturally. But when they don't have it there, you got to help them.
Yeah.
So you have to pre-plan when you have an Addison's patient
I never thought of
for stressful
something like
events.
that.
Yeah.
That's interesting.
So it's I guess we could back up because, you know, it's a whole feedback loop
Yeah.
from your pituitary gland, your brain to your adrenal gland. So, you know, it shuts each other off. And so that's what happens in Cushing's disease. You're overproducing steroids via your adrenal gland, or your pituitary gland is oversecreting the product it naturally makes, which tells the adrenal gland to make steroids. So you're overproducing steroids then. And so when we treat them, we really only treat them if they have clinical signs, and we're trying to reduce the clinical signs so the pet's a better pet at home to be around. So it's not urinating and drinking water ad nauseum for the owner. But in Addison's, then it's the opposite. Then you're not making the steroids. And so then we have to naturally or supplement them, basically.
Yep.
So to your point, we use an injectable mineral corticoid. So
Type of hormone, essentially.
that we give 28 days, 26 days, just
Yeah.
depends on the
Yeah.
patient.
And that's with the blood work changes. You have
Yeah.
to watch, but they have to be on it.
There's no going without it.
There's no going without it.
Right.
And then a lot of times, sometimes you can get away with no glucocorticoids except for in stressful events. And then the majority of them, though, are on physiological prednisone, doses of prednisone
So
Yeah.
like real small doses. Usually
So
try
they don't
to
have
get to like
clinical
every
signs.
other day. And yeah.
Yeah.
with the prednisone. Yeah. So,
Yep.
but I agree. I think they do once they're treated. Owners are like, oh, they're no longer doing this, or oh,
Yeah.
look how much better he does at this, or oh, look, you know, it's like, oh yeah, I guess all of that was attributed to
Culmination.
feeling really crappy because
Right.
you did
Yeah.
not have any steroids. People say they feel like doo
I
doo.
would imagine steroids are in every function essentially
Yeah.
of the
Right.
body. So
Yeah.
Yeah. So there's your course on
yeah.
Yeah.
for all those
Addison's
people out there.
disease,
Yeah.
aka low cortisol.
Yes.
Or
Yeah,
mineral
it's a really
corticoids.
cool disease. It's very straightforward. That's why I like it.
Yeah.
I mean, from the standpoint of like
Once
diagnosing
you know what it is.
Yeah.
Yeah.
You know,
Yeah.
it's not like there's no
Getting
gray
there is
zone.
kind of a pain in the
Yeah.
rear,
Right.
but
But there's no gray zone. It's
Right. Well, that's
easy to
kind of
diagnose.
like the
Yeah.
conversation I had with Dr. Pulse. She was like, if it were Addison's, it's just straightforward. This is what we have to do. But with Cushing's, it's going to be up to you. Do you want to treat? Do you want to wait till he's clinical? And I'm like, but I don't want it to get any worse. So
Yeah.
that's why I wanted to go the supplement route versus the Veterol route first. And because, like I said, if the supplement didn't work, then I know I had to do the Veterol. And he initially did not like the powder, but now I just mix it in with some wet food, and you would think it was Christmas every day at my house.
nice.
Yeah, pretty cool. Absolutely.
Okay, well, if we have further questions, let us know about Addison's disease.
Yeah.
Okay. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
We'll see ya. Have a
See you
good week.
later, alligator.